Hi, I'm Dr. Sonia Sloan, better known as OrthoDoc, and I'm also the author of The Rules of Medicine. And today I had an interesting conversation with a young lady that was a medical student that was wanting to go into a surgical field. She hadn't really decided exactly which one she was going to go into, third year medical student. So, as many of you guys know, you have to do the rotations and sort of decide what you want to do. Here's the thing: if you're going to go into a surgical field, you've got to show yourself worthy of that surgical field. And there's some things that I've seen medical students that really are the gunners, if you will, do better than others, as well as stepping up your game if you're really serious about this. Because a lot of the times, the people that you're going to be working with are going to be the ones that are also going to be writing your letters of recommendation. So, here are my recommendations as a medical student that's applying for a surgical residency spot that you need to make sure when you're on these away rotations or you're acting in internships, or even if it's just the rotation that you're having to get a grade on, that may be a surgical field and or any field, you better beat the surgeon to the operating room. And when I say that, I mean if I have to come and find you, or if I have to tell you where to be every time, that's a no go for me because it shows me that you're not being assertive. It shows me that you don't have the wherewithal to maybe do your due diligence, ask the nurses, ask my secretary or whoever it is, and figure it out. Secondly, you are always before as well as after, meaning just because the surgeon walks out of the room doesn't mean you walk out of the room. Because the staff that are left behind, meaning if it's in the operating room and it's the nurses or the techs or the MAs, whoever it may be, if you're still there helping, I promise you they're going to help you next time you get a chance to close the wound, or if there's something that you need to know, or hell, if it's even just feeding you lunch. They want to see you make that effort to be and do more. And then lastly, I've said this before, keep your mouth shut. There's certain questions that we all know that you're supposed to be asking about, the surgical procedure and, what is this and that, or if you're asked questions or whatever else. But otherwise, if I'm watching you, watching me, that means that you're intent. If I see you taking notes or making notes, that lets me know that you have some intentionality about learning and wanting to be there. So just definitely my advice as medical students going into surgical fields. And there's a lot other helpful hints, but you need to get my book. Have a great day.